What if I told you that the secret to controlling your blood sugar isn't just in what you eat or how much you exercise, but in something far more unexpected, something you probably ignore every single day, twice a day, right in your own mouth? We're talking about your gums. Yes, those gums. They're not just there to hold your teeth in place. They could be sounding a silent alarm about your blood sugar levels. And if you're like most people, you're not hearing it. But after this video, you will. Welcome back to the Energy Reset, where we uncover the hidden connections that impact your health. Today, we're diving deep into a topic that dental and medical professionals have known for years, but somehow, it hasn't quite hit the mainstream. The incredibly surprising and often dangerous link between your gum health and your blood sugar. You might think bleeding gums are just a sign you're brushing too hard, or maybe you've been told you have a bit of gingivitis and given a special mouthwash. But what if those seemingly minor issues are actually a flashing red light for something much bigger happening with your metabolism and blood sugar regulation? It's a classic chicken or egg scenario, but let's start with how gum disease can mess with your blood sugar. When your gums are inflamed, red, swollen, or bleeding, that's called gingivitis, and if left untreated, it can progress to periodontitis, a serious gum infection. Here's the kicker. Periodontitis isn't just localized to your mouth. It introduces a constant, low-grade inflammatory state throughout your entire body. Think of it like a persistent fire alarm that never gets turned off. This systemic inflammation makes your cells less responsive to insulin, leading to insulin resistance. And what does insulin resistance mean? It means your body struggles to get glucose, sugar, from your blood into your cells for energy. The result? Higher blood sugar levels, making it incredibly difficult to manage prediabetes or type 2 diabetes, or even putting you at higher risk of developing them. The bacteria from your mouth can even enter your bloodstream, further exacerbating this inflammatory cycle. It's a vicious cycle. Now let's flip the coin. If you already have elevated blood sugar or diabetes, your gums are even more vulnerable. High blood sugar creates a perfect storm in your mouth. First, it weakens your immune system. Your body's ability to fight off bacterial infections, including those in your mouth, is compromised. So, those oral bacteria that cause gum disease? They have an easier time setting up shop and wreaking havoc. Second, high glucose levels in your saliva promote the growth of harmful bacteria. It's like giving them an all-you-can-eat buffet. Third, high blood sugar can damage the tiny blood vessels that nourish your gums. This reduces blood flow, making it harder for your gums to heal and fight infection. So, even a simple cut or irritation can become a much bigger, more persistent problem. This is why people with uncontrolled diabetes often experience more severe and frequent gum infections. The consequences of this bidirectional relationship are far-reaching. Uncontrolled gum disease can lead to tooth loss, pain, difficulty eating, and even impact your speech. But beyond your mouth, consider the bigger picture. Worsening diabetes control. If your blood sugar is already high, gum disease makes it even harder to bring it down. Increased risk of diabetes complications. Poor gum health has been linked to increased risk of heart disease, kidney disease, and other serious diabetic complications. A cycle of frustration. You try to manage your blood sugar, but if you're ignoring your gums, you're constantly fighting an uphill battle. So, what's the good news? You have the power to break this cycle. Taking care of your oral health is not just about fresh breath. It's a vital component of managing your overall metabolic health. Here are actionable steps you can start today. Brush twice daily, floss once. It sounds basic, but consistent. Proper brushing and flossing are your first line of defense. Regular dental checkups. Don't skip these. Your dentist can spot early signs of gum disease and provide professional cleanings that remove plaque and tartar buildup your toothbrush can't. Manage your blood sugar. This is crucial. Work with your doctor to keep your A1C and daily blood sugar readings in a healthy range. The better controlled your blood sugar, the healthier your gums will be. Quit smoking. Smoking is a huge risk factor for both gum disease and diabetes complications. If you smoke, quitting will significantly improve both. Eat a balanced, low-sugar diet. What's good for your blood sugar is good for your gums. Reduce processed foods, sugary drinks, and embrace whole, nutrient-dense foods. I know it can feel overwhelming when you hear about yet another aspect of your health that's interconnected. But think of it this way. Taking care of your mouth is an incredibly powerful, yet often overlooked leverage point for your entire body. It's a testament to how everything is connected. Your body isn't a collection of separate systems. It's a symphony, and if one instrument is out of tune, the whole orchestra suffers. By paying attention to something as seemingly simple as your gum health, you're not just preventing bad breath or cavities. You're actively supporting your metabolic health, reducing inflammation, and giving your body a better chance to thrive. Prevention, as always, is key. Don't wait for your gums to scream for attention. Listen to the silent alarm now. Have you ever noticed a connection between your oral health and your energy levels or blood sugar? Let me know in the comments below. I read every single one. If you found this video insightful, please give it a thumbs up and share it with someone who needs to hear this message. And if you haven't already, make sure to subscribe to the Energy Reset for more deep dives into optimizing your health from the inside out.